Hey guys, Jim Hoffman here again from Turomedic, and I want to cover in this video real quick the different types of open soft tissue injuries you're going to see as an EMS professional. Get right into it today because I want to really make this as short as possible, kind of give you this content because you're going to see this stuff on exams and you're going to want to use this when you're documenting your paperwork and things like that. So the first one is an abrasion. Pretty much this is the superficial wounds and it's caused by a friction on top of the skin. So you're going to get that abrasion. Very minimal bleeding usually, and sometimes they can look pretty gruesome, but for the most part, they're not life-threatening type of soft tissue injuries. The second one is a laceration, and this is a jagged cut in the skin. It's very important to remember that the jagged cut in the skin, and this can be caused by various things that can, open up the skin. Usually, glass can do it. Other sharp objects that that the patient might come across. All these types of things that can cause a laceration, that jagged cut in the skin, which is in opposite of the third one, which is an incision. Now, the incision, a lot of times you'll see these with a knife cut, a razor, sometimes glass as well. These are those nice, sharp, smooth cuts, and often sort of like a surgical type of a cut, okay? And again, the bleeding can be the same for a laceration or an incision, depends on how deep it is, where it is, okay? But just know the two differences between that laceration and an incision, between the jagged and the nice, smooth cut, okay? The fourth one is avulsions, and this is when you've got flaps of skin, and these are either completely detached from the body or completely detached from whatever extremity it might be on or what part of the body it's at, and they can or be hanging from that area where the injury is as well. So it's either flaps that are either completely detached or they are hanging. Now, the fifth one, and this is something that can be very disconcerting to people, is the amputations. And these are a complete severing of a body part. A lot of times in EMS, you can go years and years without seeing an amputation, and then you can have a bunch of them in one shift. You can have a bunch of them in 1 week. And this, you got somebody that loses a finger, somebody loses a hand, an arm, a leg, and a foot, whatever the case may be. So those are amputations, okay? This is when we start talking about things like using tourniquets and more severe bleeding, specialty centers to take patients to because of the amputation. So those are the 5 open soft tissue injuries you're going to see. Now, what about some of the management when it comes to soft tissue injuries? Well, real quick, pretty much this is something that you can use this mnemonic, not use it, but for closed injuries, you might have heard something called the Rice's mnemonic, and this is rest, ice, compression, elevation, and splinting. Now, this approach helps reduce swelling and pain and also helps reduce bleeding. So when you have a closed injury, use that Rice's mnemonic, okay? Rest, ice, compression, elevation, and splinting. Now, for open injuries, you want to use the same protocol that you get for any type of external bleeding. Direct pressure with bandages, dressings, you get the tourniquet application for extremities, and then you can also use those hemostatic agents for uncontrollable bleeding. Now, I did a 3-part series about bleeding and bleeding control before here on the channel. So if you want some more information about bleeding control and the different types of bleeding, whether it's capillary, venous, arterial, go check those videos out. So guys, I'm going to wrap this one up. Again, I want to keep it real short for you today, but just remember, soft tissue injuries, whether they're open, whether they're closed, they do require our often, most of the time, prompt, but more importantly, our effective management, okay, by us as EMTs. So when you understand the types of injuries, you know their signs, you know the appropriate treatment that is needed for the different types of injuries. Again, whether it's an abrasion or whether it's an amputation, if you know the appropriate treatment, it's crucial for the best outcome for our patients and what we're doing out there in the field. So remember, that correct approach, it really can impact that patient outcome in a lot of times what I would say is a common, but often many times varied types of emergencies, right? You could have a cut in the arm, it's nothing. You might have something on the leg where you've got maybe the femoral artery is involved, or maybe it's an amputation. So all these things you have to sort of think about when you come in contact with these types of patients. Then oftentimes the treatment is very similar, but how you act and what you do can be a little bit different for each patient. So I'm going to end it there, guys. Again, I hope this really helps you out. If you want some more free study tips and hacks, go check out TurboMedic Insider. It's 100% free. You can go find out more information and sign up and grab it over at myturbomedic.com. All right, guys, that's it for me. I am Jim Hoffman from TurboMedic. Stay safe.